Welcome to Ali Fitness Podcast, a weekly production all about bringing health into fitness. Jonathan Mendoza has been trained in traditional and alternative medicine. Starting with a bachelor's degree in exercise and sports science, he became a doctor of chiropractic and, if that was not enough, he decided to learn traditional medicine in hope that he could provide many different therapies options for his patients. Today, Jonathan is a registered nurse with a Master's of Science in Nursing as a family nurse practitioner. He's now living his dream, running a holistic healthcare clinic that offers well-rounded therapy. I met Jonathan and probably within about 5 minutes he had my pants down. But don't get too excited. He just injected me with one of his therapeutic injections. So Jonathan, welcome to the show.
Thank you for having me, Ali. I appreciate it.
And it's nice to be wearing pants this time when we talk.
I saw a lot of butts that weekend, I'll tell you that much.
So Jonathan, can you just share with us firstly, I guess, how you got all into this and then sort of, I guess, your journey into where it got you today, which I sort of feel like you're living your dream.
Oh, yeah, I very much feel like I am living a dream. This is like one dream I hope I never wake up from. I have a pretty good background from, both sides of the spectrum of traditional and non-traditional medicine. And when I first learned about nutrition, I learned it as a chiropractor, but I've been able to apply it as a nurse practitioner. And when I worked as a nurse practitioner several years back, when I first was in practice, I was in a very traditional setting. I was actually in pain management. And if you're familiar with that, that's where, you get the opioids and the pain management prescriptions and those drugs. And I tried my hardest to make a difference, incorporating diet and nutrition and even like yoga with some of my patients. But it's very hard to break that mold. And I said, if I'm going to deal with this all the time, I'm going to do it under my rules and regulations, and I'm going to do it my way. So I started to branch out and form my own clinic. I wanted to be an entrepreneur and I wanted to focus on health and wellness. And I studied nutrition for probably the past decade on my own, learning a lot. And even, at PaleoFX, learning from some of the greats like Ben Lynch and, even Joseph Mercola. Those guys really set the foundation in my head for what I established here in this clinic of providing optimal health and wellness. And I think that my approach is very simple. I think that everyone should incorporate food as their medicine. And if they get all their nutrients from their food, that's perfect. But you and I both know, Ali, that our food today is not what it was 100 years ago. So if you can't get all your nutrients, the best way to get in your body is vitamins.
Excellent. So what exactly does your practice offer?
So the practice here in Austin is called MSW Lounge. And what we offer are vitamin shots and vitamin IVs. And we even make vitamin drinks. I don't know if you got a chance to have one of those drinks we have. We essentially offer high quality vitamins from a nutraceutical, pharmaceutical grade viewpoint. So when people come into our clinic, it's actually a medical clinic, but it's very much a lounge. So it's a la carte. People walk in electively to get a shot. They'll come in here. We have a beautiful, like a smoothie menu, almost that you would see at a coffee bar or something. And people come in, they look up and they're, I want a B12 vitamin injection. Can you add like glutathione to it? And what people love about it is it's very quick. So they'll come in, they'll get a shot literally in their butt. And it takes, a few seconds to administer. And then within an hour or so, they get the absorption to its full effect and they start feeling a better difference. They may have better mood. They might have better sleep later that day. They might have a better workout. The vitamins that we offer can also come in the form of an IV. And with most people in America, they see all these IV clinics that are popping up. Most people will want to say, well, we're different than other people because we offer this, we offer that. That's fine. What we really look at is this. We're not a hydration clinic. We're not a hangover IV clinic. We're very interested in optimizing health and wellness because our clientels come in. They want, things for jet lag. They want stuff for a presentation the next day. They want nootropics for focus. And so the IVs that we offer, they're not huge vitamin saline bags. They're little tiny bags, but we put more vitamins into them. Every time you get one of our shots or IVs, and even when you did, you know that they're getting high quality pharmaceutical grade vitamins that are getting into the body best way possible.
Great. So what's the difference then between a shot and an IV?
Perfect question. A vitamin shot can go into the gluteal muscle or it can go into the deltoid. Some people put into their thigh. And it's pretty quick. A lot of people who are on the go, they love it because they're in and out within 2 to 3 minutes. And it's pretty much almost 96, 98% absorption rate. I don't want to say 100 because nobody likes to, over guarantee things. It's a smaller syringe compared to that of an IV. And so when I say that, in a shot, I can put a little bit of vitamins in it and fill up the whole syringe, or an IV, I can put as much as you want in there. And so if you ever get a chance to get an IV or a shot, always get the IV because you can get way more vitamins and materials and ingredients put in there. But keep in mind, the vitamin IV might take anywhere from 15 to 45 minutes to an hour. It's much better and you feel it more effectively. But for some people, time is of an essence. And so they much rather elect to get a shot because they know it'll still be effective, but it only takes a few seconds.
Okay, so if you get a shot, I assume the effects come pretty quickly, but how long do they last for?
So the shots can vary. Most people tell us about 1 to 3 days is the average. Some people say up to a week. The IVs could last up to a week, possibly even longer than that. It depends on that person's, their homeostasis, where they feel at in their life. If they're dealing with a hangover, they're probably needing an IV just to get them through the weekend, and they'll probably feel better by, an hour or two after the IV, and it'll probably last through Monday. But let's say they have an autoimmune disorder where they have digestive problems. They might feel good for maybe a day or two afterwards, but you and I both know that they're going to need more than just one treatment to combat, autoimmune disorders. So it might take a couple before they really start seeing the prolonged effects.
And so how does one know which injection or which vitamin to go for? How do you help them through that process?
Well, it's interesting because a lot of times when people come up, the first couple of things that they mention are very common issues that most people would deal with. And so people want energy because they're tired all the time. People have trouble losing weight, so they want something for weight loss. Other people feel like they need something to kind of flush out allergies in their system, right? I know when you came here for paleo, I don't know if you felt the seasonal allergies at all, the environmental allergies, coming in here. A lot of times people will say, hey, I need like an immune boost. I'm feeling a little under the weather. Do you have something for that? So a lot of times when people come in, you can kind of pinpoint what they need based off of what they're telling you, right? Because once again, this is all elective, right? So I'm not telling people off the street, if you have, high blood pressure and you have diabetes, you need to come in here and get these shots. The truth is, these shots can be applied towards diabetes and high blood pressure, but we have a lot of healthy people coming in here in Austin, and a lot of times they just need a quick pick-me-up and they just don't want to drink coffee all the time. So when they come in here, we set it up to where everything is pretty much self-explanatory, including that menu we have on the wall. So if we have B12, we have a little subtitle next to it that says good, clean energy. If they want, something for detox, we have glutathione, which basically will boost your immune system, stuff like that. So a lot of times that is very straightforward. But let's say if they have something that's a little more in depth, I usually go into like a 5 or 10 minute consult with them and just kind of figure out what the underlying issue is. And then maybe we can address it there. If they want to go one step further, one of the other things that we do in the clinic is we offer laboratory testing to see what's going on with them internally. Because one of the things I've learned in medical practice is 90% of your diagnosis is going to come from your medical history with that patient. So if a person comes in and they have, 8 things wrong with them, in a traditional medical clinic, if you see 30 patients a day, there's no way you're going to be able to sit down and talk to them about all 8 different issues going on. You address one thing and send them out the door because you got a waiting room of people, outside. But if you have a very relaxed setting like what we have here, people can come in and feel the need to, tell us everything what's going on. And they might think they're telling us too much, but it's basically connecting the dots because it might be like, this is affecting this is affecting that. And there's two, some people don't go to the doctor. So they don't know what their hormones are telling them. They don't know what their thyroid has been checked at. They don't know what their liver enzymes look like. So a lot of times we order blood work and urine tests to see what's going on internally, what we can't see on the surface. And then we customize those shots and IVs based off what the labs are telling us.
Great. And how long does it take for you to get those lab results back?
Some of them are very quick. The urinalysis test is usually about a day or two afterwards. And the blood work is usually about a week afterwards. And it's great because, that's a pretty good turnaround. And a lot of times it's very easy for someone to come in, talk about this with us. They get their blood drawn within a couple of days. And I say, well, come back next week. We'll get the labs. We'll sit down and talk to you about it. But it's also one of those things, too, if they've had recent labs, they can bring their labs in, too. And a lot of times the vitamins that they get, like I said, can be customized for their needs. But essentially, instead of taking medicine all the time or taking a bunch of supplements orally, they just come in here and get their shots and IVs and their vitamins through this.
Excellent. So let's take, say, B12, for example. What's the benefit of coming in and getting, say, an IV therapy of B12 as opposed to taking a B12 supplement?
If you look on the hierarchy absorption in the body, the low part on the totem pole is going to be something of like an oral supplement. If you take an oral supplement, usually about 30 to 40% of it is going to be broken down by the time it even gets to the intestinal tract to be absorbed. Because you have to bypass your stomach, you have to bypass the liver, and of course the digestive tract. So even these high potency vitamins that people take all the time, they might not always work because one, either the quality is too poor or their body's not able to absorb it. So then if you go one step higher, you have sublingual drops, which are really good alternatives because they bypass that digestive tract and it goes into the bloodstream. You go a step up than that, you have intranasal sprays, then you have patches and creams, and then at the top of it is obviously the injections and the IVs. So a lot of times when people come in here and they say, oh, I'm taking a B12 as a pill, I'm like, cool, well, have you taken it as a shot? No, I haven't. Okay, well, think about this. If the digestive tract is poor, that B12 pill you're taking, if you're only getting 30% of it to absorb, how do you know if it's working? Unless you're looking for certain things like maybe more energy, better sleep or so. But with the shots, you're getting close to 100% absorption, and you'll get better feedback from those people. In fact, people who even say they take B12 who get the shots here or an IV, they say they can feel a difference because it worked faster than normally.
Have you actually done any clinical testing with that as well?
I have actually. So a lot of times we measure in the blood work nutritional deficiencies, things like B12, B9, CoQ10, vitamin D, B6, and we can see the measurements in the blood work compared to when they're doing the shots and IVs as opposed when they're doing an oral supplement. And it's interesting because you'll have people that say, I've been taking that for months and blah, blah, blah. And then you look at their blood work and their urine test, and I'm like, well, it's not absorbing. It gets a little bit of disappointment to them, because they're like, well, I'm paying good money for this and it's not absorbing. What am I doing wrong? And I'm like, well, it's not that it's a poor quality product. It just might be this is not the best way to put it in your body. You might need something else that's a little bit different. So I can tell you this, everyone that comes in here that's been a longtime client of us, they get a lot of B12. And so when we measure their blood work, their B12's through the roof because I know it's being absorbed because, they're getting it through a shot. But I'll be the first one to tell you, having too much B12 is like having too much fun. It's just basically like, yeah, if you get enough of it, it's just going to wear you out. But if you get too much B12, you're pretty much going to pee it out. If your body doesn't absorb all of it, it's just going to say, we'll store some for later, right? But there's no toxicity with B12. There's toxicity levels with maybe vitamin C. If you take too much of it orally, you can get diarrhea from it. But if you get vitamin C through an IV, there's no diarrhea because you're bypassing the digestive tract, right? So you can even go higher on the vitamin D dosage in an IV.
And can you mix the therapies? So, for example, let's say I was low in B12 and glutathione and perhaps, say, vitamin C. Could you mix all those together and give me a shot?
Of course. Now, I would say this, depending on the ingredients, I would probably not offer certain things in a shot or an IV. Now, for example, if I gave you vitamin C, I would definitely give that to you in an IV because it's very acidic, obviously. It'd be kind of painful to give in a shot. But if you wanted to come in here, let's say that a person they were tired all the time, they're having trouble sleeping, and then they were just getting over a cold. I would say, okay, cool. Well, how about let's put some B12 in there for energy. Let's put some glutathione in there to boost your immune system. And then let's put a little B5 in there to help kind of lower your cortisol levels. That way you can sleep better at night. And so when you have that approach, I know I said before that all the shots were customized to blood work and all that, but a lot of the shots in here are customized to what that person's needing at this time. And everything is like Burger King here. It's basically made to order. So when people come in here, there's nothing that's pre-drawn. Every time they come in here, I draw everything up individually and add them all together in one shot. And a lot of times those ingredients like B12 is red. Vitamin C is clear. Glutathione's clear. Our B complex is yellow. When you move them and push them all together, it comes to like an orange or it comes to light pink and all that. And it's pretty colorful. And a lot of times people like that.
So how often does one need to come and see you? One need to come and get a shot? You mentioned that sort of the IVs can last up to a week. So does that mean that probably you'd need to be coming once a week?
It depends on your needs. Now, I can tell you this. There'll be some people that come in and maybe get a B12 shot once a month. There might be some people that come and see me and get a B12 shot once a week. But then it depends on your needs. So, for example, if you're chronically deficient in your ability to fight off infection, like you're immune compromised, You might need like maybe one IV a week until you build up enough strength to basically spread that out over months. There's some people that come in here for weight loss, and we have a shot called Slenderella, and that has B12 in it, but it's a liver detox shot, and it shrinks fat cells and it causes people to lose weight in inches. Those people who are trying to lose weight, they usually come in here 2 to 3 times a week to get a shot to meet those needs.
And how much scientific research has there been on the Slenderella?
Well, it's funny. The Slenderella is actually our personal concoction. There's tons of research on it. We've been doing it for a couple years now. I actually, in addition to the vitamin clinic, it's also like a concierge practice. So there's a lot of people that basically treat me as their general practitioner. And so people will come in here and say, do all my blood work all the time. And so I have basically like data from all the clients here that we've compiled over the past couple of years. And we can see how the liver detox affects the liver enzymes, how it makes the kidneys, work better, how it lessens the BMI, reduces that. We take that measure when we come in here. We have one of those handheld fat analyzer tests, and we have them start off at the beginning, and then a month later, 2 months later, and we do blood work and urinalysis tests every 3 months. That way we can see if the difference is being made. And if it's not, then we can go in there and rewrite the formula for them.
And is that Slenderella a secret formula?
It's not a secret formula, actually, because now we actually have a pharmacy in Houston who's actually producing Slenderella vials so people around the country can actually buy them and inject them in their medical clinics as well. So the formula for Slenderella is a very good one. I'm very proud of it. It's methylcobalamin. It starts off with that. So that's B12. I think that's one of the best bioactive forms of B12. And with people who have methylation issues or have that methylation gene, they tend to have issues absorbing B12 and metabolizing it. So most people can metabolize B12 very well. And then we have some liver detoxers called methionine, anastrostol, and choline. Choline is one of my personal favorite amino acids because it's essentially a liver detoxer and a brain detoxer, because choline is also known in the neurological world to basically cause synapses in the brain. So for nootropics that are basically popular, and you've seen a lot of those at PaleoFX, everyone had a nootropic on them. Well, we have one too. It's called Brain Candy, and that has, choline in it as well. And so the choline that's in the liver detox, the Slenderella one, that will go in there and basically get rid of all the fat that's accumulated inside the fat cell, but it also causes the brain to synapse and think quicker. One of the other ingredients that's in our Slenderella is carnitine, and it has the ability to burn fat. And if you're a vegan and you don't eat meat, you definitely need to supplement carnitine, because carnitine is, Latin for carne. Essentially, that's where you get your amino acid that you need to build protein from. You get it from animal products. And then the other ingredient that we have in the Slenderella shot that I'm so proud of, I'm so thankful we were able to get it in there, is vitamin B6, and the active form of it is P5P. And the reason we put the active form of P5P in there and not vitamin B6 peroxidane by itself is because the active form of P5P in neurological and neuroscience, P5P is involved in the ability to produce more serotonin, the ability to produce more dopamine, the ability to produce all those neurotransmitters that we typically have deficiencies in depression, anxiety, Alzheimer's. So the P5P that's in the Slenderella shot will not only detoxify your brain and your liver and cause you to lose weight and give you energy, but the P5P is actually going to boost your serotonin levels and your dopamine levels, so you're happy while you're getting the shot, while you're waiting to lose weight. All of our ingredients that we offer here, like I said, we have shots, we have IVs, we have drinks. We have Slenderella in a shot form, an IV form, and even a drink form. In fact, I have a Slenderita that's sitting right next to me, and it has a lot of the same ingredients that I mentioned in the shot, but even in this drink, it has like glutathione, it has taurine, it has arginine in it. And what I want to tell everyone with the Slenderella, it's basically, the concept is a liver detox. So any of the ingredients that we offer here in our clinic, they essentially all could be ingredients into a Slenderella formula that essentially does the same thing. It detoxifies the liver and it detoxifies the brain.
Awesome. So have you patented that?
Slenderella is an actual trademark name. Yes, it is. I do know that there's a lingerie Slenderella in the UK, but we are trademarked here in the United States as a nutritional company.
But can someone copy that formula?
They might be able to. I think about it in this sense that the formula is always going to change, because what we look at is this. Let's say that a person comes in and they have an allergy to B12. Like, the B12 that we get here, it comes from non-GMO corn, right? So if they say they have a corn allergy, then I'm going to say, well, let me take out B12, let me put something else in there, something that falls along those lines, right? Let's say that person comes in here and says, oh, I already take P5P, I don't need any more of it. Okay, well, how about we put, N-acetylcysteine in there instead? Okay, let's do that instead. So like I said, with all my formulas here, they're all kind of made as we go, but every single ingredient, which could be up to 30 of them, they could all kind of interplay and mix with one another. And it's not to say that there's only 4 ingredients to go into Slenderella. There could be many of them. Just with the shot, we formulated to have those specific ones because we wanted to target weight loss and we wanted to target brain detoxification with those.
Wow. So if a client doesn't change their nutritional habits, nor do they change their exercise routine, and they come, say, 3 times a week and have a Slenderella shot or, say, an IV therapy, how much weight would they lose? I mean, I know that's the $1 million question, but maybe you can, just look at anecdotal evidence or.
Sure. So I would say what we've seen in the past with people coming in for 2 shots a week, usually around the 3rd or 4th week is when it starts to take effect. And I would say within 1 month, you would probably say about 1 to 3 inches is what you would expect to lose as far as your weight loss program goes. Now, keep this in mind. There's 2 factors. Obviously, the diet plays a huge role, right? Like you don't tell someone, here's a shot to help you lose weight and expect them to continue to eat all the chocolate cake and brownies that they've been eating. No, you have to meet me halfway, right? Because the idea is we have to get rid of all the stuff that you've built up in your system to begin with. So I tell people when they come in, with diet, it's very simple. People want to feel like they have control of what they can eat. And I want people, when they come in here, I want them to feel like that. So I don't want to tell them, you can't have this, you can't have this, because even in your world, Allie, you've seen it too. When you tell people they can't have a certain food, they tend to get kind of upset about it, almost kind of resistant towards it. So a lot of times I look and I tell something simple like, okay, name 3 foods that you absolutely love to eat or indulge in. And a lot of times you'll be surprised. You'll be like, oh, well, you'll get the wine and, the bread and cheese. But other times it's like, well, I can't give up cereal or I can't give up like strawberries. I'm like, okay, well, that's fine. Which one of those 3 foods are you willing to cut back on so we can give this shot a chance to work? And then usually they'll pick like, well, I can give up, cheese for the next month. Okay, cool. Let's do that. Let's see how it goes. So that will usually be the case. And then when it starts to take effect, the other interesting thing is what catches people by surprise. Because when people think about weight loss, they think about losing, I got to lose 10 pounds by, the next 2 months. Or I got to lose 15 pounds by the wedding in June, And so I tell people like, well, you might not lose the 15 pounds you're looking for that quickly because this is more of a sustainable lifestyle change. The idea is you're going to lose inches, which you and I both know is a lot harder to do than to lose weight. I remember, telling people years ago, I was like, if you want to lose 5 pounds of weight, you can literally spit into a cup all day. You'll probably lose 4 to 5 pounds. I mean, you know that, right?
Just don't drink any water.
Yeah, just don't drink any water. You won't have any weight gain, right? But that's not healthy, right? And so we can fluctuate 5 or 10 pounds, throughout the course of a couple of weeks, but to lose inches, that's a really different strategy. And so when people start the shot, they tell me that usually affects them at their chest, and then it works its way down towards the belly. And I tell them, well, that's where you hold on to your fat. So imagine where all of our fat cells are. They're usually in our chest, our belly, our arms, and our thighs. And so I tell people, if you want exact measurements, we'll do your fat index analysis. And then at the same time, do a measurement with, a little tape measure. Measure your biceps, measure your thighs, measure your waist, measure your chest. And then after a month, tell me if it's working or not.
But I mean, I don't mean to be cynical, but obviously they are changing their diet. So how do you know how much of it was just due to them changing their diet versus the magical drug?
Sure. The reason I know there's a difference is because I hear this all the time, and you hear this too. I've changed my diet. I'm paleo, I'm keto, I've done the Whole30, I'm gluten-free, I've done all this stuff, and I still can't lose this last little bit of stuff here. And they point to their belly and they point to the little belly fat. They're like, I still can't lose this last 10 pounds. So, and I'm like, okay, well, how long have you been trying? Oh, I've been trying for, 6 months. I've been trying for a year. And I'm like, okay, have you done a detox? And they're like, no, I'm not going to do a juice cleanse. I've done that before. I don't like juicing. I'm like, no, not a juice cleanse, because I don't want to do that either. I don't want to drink juice all day. I think we need to eat real food. I'm saying, like, what about a liver detox? That basically goes into your system and detoxes all those fat cells that are swollen and inflamed, and it gets rid of all those toxins that are causing you to be bloated and hold on to all that water weight and make you gain weight. That sense is essentially what Slenderella does. That's essentially what a liver detox does. Because if you think about it, most people who go into your business or even come into a personal trainer or maybe a nutritionist, none of them are doing liver detoxes. I can tell you this right now. If you think like, well, what's a liver detox mean? A liver detox is taking something like glutathione, N-acetylcysteine, turmeric, milk thistle, quercetin. All of those things, if people are taking it, that's good. They've kind of, stumbled upon it themselves. But if you do it for like 30 days to 60 days straight to the max, where it's nothing but a liver detox, you will lose weight. You'll burn fat and you'll detoxify. And if that's the one thing they have not done in the past couple of years to lose weight, and they come back and they say, oh, I'm losing inches and I've lost a couple of pounds, I can tell. Then I say, okay, that's the difference, is that you're doing a liver detox now. You've cleaned up your diet a little bit, but maybe they've stayed on the same diet. They stayed on the same exercise routine. The only difference is they've done a liver detox now.
Awesome. So what sort of price would you pay for, say, coming once or twice or even 3 times a week? Is there an average price for your IV injections?
Sure. So our intermuscular shots, which are the actual shots, those range anywhere from $20 up to $60, depending on what you want to put on it. Our Slenderella starts off at $30. There's a Super Slenderella for $40. We're about to do away with it, and it'll just be a $40 shot. And then we have packages. People can buy an 8-pack, and they'll save money on it because they get a discount. The IVs are a little bit pricier, and we understand that because obviously there's a lot more that goes into it. But we try to make them very reasonable as well. And so they'll start as low as $49, and they go up as high as $250. Obviously the $49 IV versus the $250 IV is going to be a big difference because the $250, you can get anything you want in it. But the $49 will be like, oh, I just need a little bit of energy. Can you give me a quick burst of like B12 and something else? Yep, $49. There you go.
Got you. So someone might come and do, say, the $250, and then eventually they feel much better after a couple of weeks, and then they might drop down to a cheaper one that had a lot less in it.
Of course, yeah. And that's the thing too. Even our IVs are formulated. I'm looking at the menu right now. There's rapid, there's a basic, there's a premium, and there's a custom. So there's a tier system on it, right? Like let's say I give you this much for a $49, I can increase it for, the basic. Some people change their IVs. One week they're like, well, I want this for jet lag. The next week I want it for immune boosting. The following week they're like, well, I just ran a marathon. I need something to detoxify my muscles and recover. And so they can kind of play around with it. And it's really cool because after a while, they kind of start dictating what they want in the shot and the IV already. First, when they come in, it's an educational piece, right? Because you have to tell people, why do you need a liver detox? Why should I put this in my body? Why can't I just do B12, from my local pharmacy? I'm like, well, this is obviously better and, there's a better way to get into it. But then when they start getting that concept and they start feeling the difference, they see it in their blood work, they start saying, you know what? I noticed with, choline, I'm able to think a lot faster and I'm sharper during my business meetings. I think I want to add more of that next time. Or they say, you know what? I'm a little sore today. I think I want some amino acids for muscle detox. I'm going to put some arginine and some taurine in there. And it's cool because I'm like, cool, that we can put that in there. Next time I ask them what they want, it might be something completely different.
So you find that the general public are that intuitive?
I have to give the public the benefit of the doubt. They're not stupid, right? People are not stupid in this country. Thanks to the internet, we have access to all kinds of research and databases that we want. You take a biohacker, for example. A biohacker is usually a very intelligent person who never goes to the doctor's office, right? But you think of them, they're the type of person that you would ask them all kinds of health questions, right? Not medicine questions, but health questions. Because they go out of their way to do their research. And when they come in here, they know what they're talking about. I almost get tested sometimes because they want to know that I know what I'm talking about, right? So when people come in here, they know about B12. That's the tip of the iceberg, right? But they've also said, I've been taking glutathione for a couple years now. Or I've been putting turmeric in my eggs in the morning, but I put black pepper in there because someone told me that it helps fight cancer cells. You look at the movement now with CBD products, and we saw a lot of that there in paleo. I mean, it's not like these people are coming in saying, is this going to get me high? Is this marijuana? Is what? No, it's hemp, it's CBD, it's therapeutic. This is medicine for you. And it's catching on. And I think with the grassroots movement of health and wellness in this country and preventative medicine, you have a lot more people that are educated in that sense. I mean, how many people now, especially even in their 60s and 70s, are taking some vitamin in some form, whether it's vitamin D, whether it's a fish oil, whether it's even a B12 complex, they're taking a little bit more. And I think they're craving this stuff. The problem is that doctors don't know about nutrition. They were not taught this in medical school. They were not taught about glutathione in medical school. So if they knew about it, they might be willing to offer it to them, and it might be a little more mainstream. If the pharmaceutical companies could patent glutathione, I'm pretty sure you would see glutathione between all the evening news channels, between 6 and 6:30 every night, and everyone would come walking in, oh, I need glutathione. I need a glutathione. But I think that the more and more that people are searching for other avenues to incorporate their health and wellness into, I think they're coming across more and more about vitamins. And if there's one thing that, even the listeners, who are listening, they take away from, I want them to know that I am all in on the vitamins, because from a biochemical standpoint, you can be deficient in B12 and not have anemia. You can have B12 deficiency and be depressed, because there's a genetic gene that I can test in blood work that shows me, yes, you are depressed because you don't metabolize B9 and B12 like other people do. And so you treat it as a form of medicine. And when you do, now you start saying, okay, vitamins are here to stay because they are a form of medicine that could be essential in treating not only depression, but maybe diabetes and high blood pressure, maybe Alzheimer's in the future as well.
Yeah, interesting. So where do you think the future's taking us with this in terms of, I guess, technology and science with respect to IV and vitamins versus, people staying at home and taking their own vitamins? What do you think is going to happen?
I think it's going to continue to evolve. There's going to be probably, the extremists that want, CBD in their IV, which is fine. I'm one of those people. If I can get my hands on extracted CBD that I can put into a shot or IV, you better believe I'm going to put that in there. But then you also have people that also know that this is probably going to be a very saturated market from a business standpoint. I mean, I know that, you talked about, being in New York, there's not a lot of clinics like this and all that. I think that's probably going to change within 10 or 20 years. I see a lot of people who are doing IV clinics, very much for the business sense of, they're not doctors, but they know that it makes them money. So they want to, go ahead and put it in there. But when you start looking at all the research behind it, there's a lot of validity behind it. And all the campuses and universities throughout the country that are doing any kind of research, they're incorporating things like glutathione and taurine and NAC for liver detoxification. And they're seeing the effects of even biotin and how that affects their DNA, because biotin actually makes DNA. They look at P5P and see how it's affecting Alzheimer's and Parkinson's. And as it becomes more mainstream, I think what's going to happen is the ingredients that we use are only going to get better and better and better. And if you think about it, think about this. All the vitamins that we get from a shot or an IV in this clinic, they all come from an FDA-approved pharmacy. So you got to think about all the vitamins that are out on the street right now. You don't know what kind of quality you're getting unless you get it from a reputable source, right? So getting a vitamin from a company that's approved by the FDA, I mean, I don't know what much higher you can get than that. But you got to imagine that it's not going to be that there's going to be a new way to try an IV in the future, right? Instead of getting an IV in your arm, you get it, in your foot. That's the same concept, right? And, the IVs and shots are never going to go away. But, I've seen B12 vapes. I've seen CBD tinctures that mix in, glutathione and B12 with it as well. I think there's like even edible like choline and B12 now that you can get. There's just going to be different forms of it, but it's going to be the same vitamins and ingredients. They just might be like better, purer forms. That's what I think.
And so are there several clinics at the moment that are offering what you are offering?
There are, but it's far and few between. What I've found in practice, from doing this over the years, the people that have been doing this for the last 30 years, they're very old school physicians and naturopaths that essentially don't tell other people what they're doing because they want to fly under the radar, right? Like, think about it. If they're treating, somebody with stage 4 cancer, or they're treating someone with autoimmune disorders and it reverses it, it's one of those things that it's probably good for the public to know about it, but it might not be good for that practitioner to know about it, right? You might want to know who's giving the therapies, but at the same time, it's not mainstream enough to where everyone around the country is flying into, Salt Lake City or Austin, Texas to get these things done. But what I think is going on is we're trying to separate ourselves in this clinic from the hangover clinics, because I don't know what's going to happen with that, right? Everyone's always going to drink, right? But I don't drink anymore. I'm not interested in treating hangovers. I'm interested in, treating really chronic diseases. And as long as people are interested in providing nutrition in their clinics, I think these types of clinics will continue to evolve and continue to thrive and maybe even grow. But right now, if you're not in a metropolitan city like Austin or, New York, Dallas, or Houston, or, even LA for that matter, it's very, very hard to get your hands on this. So that's why you still see people from the country that come in and drive all the way, 2 hours to get these treatments because they can't find it anywhere else.
I guess I've got two questions for you. The people that can't get to the clinics, I guess what would you recommend apart from driving into a clinic? Is there any other options for them?
I always tell people this very simple thing. I don't care where you get your vitamins from, right? You can get your vitamins from me. You can get it from the guy down the street. Just make sure it's a good quality vitamin, right? In the sense of the hierarchy, going back to, again, shots and IVs, best way to do it. You can't do it. The next form would be, creams, intranasal sprays, and sublinguals, right? And then, of course, orals. So we've had people that reached out to us from, North Carolina and Boise, Idaho that say, hey, I want Slenderella here. I have a friend in Oklahoma City. He's like, how do we get Slenderella here? No one's prescribing it. That's why we basically talked to our pharmacists and said, like, hey, there's a need for this throughout the country. We need to get these shots in the hands of any practitioner who's willing to make a difference. And, the Slenderella is not just a weight loss shot. Like I said before, it's a liver and a brain detoxer because it's good quality ingredients. But if they can't get it in a shot, then the next best thing is they can get it in a powder, right? We offer our drinks, it's a multivitamin drink that we make with Topo Chico and lime. I'm drinking one right now. It's absolutely amazing, but it's a multivitamin that they can get glutathione in. And I don't know too many energy drinks that are on the market that even offer glutathione. When we talk about that, we got to reach the masses. And so we have a lot of clinics that sell these things, but we have gyms, we have yoga studios, we even have a cryotherapy clinic now who's starting to sell some of these supplements because they know it's better than what they're finding out on the market or what they're allowed to be able to sell, within what they've found from other types of supplement companies.
And Jonathan, sorry to interrupt, are you selling online as well?
Yes, we're selling online. I don't know if you want me to plug it or not. If you look at SlenderellauSA.com and MSWLounge.com, you can get Slenderella energy drinks. You can actually, today, just absolutely right now, we sold our first one. We have Slenderella weight loss pills. They're like capsules, right? And so you could go online and actually buy those, and we ship them out to anywhere. We ship them out all over the country. We're going to be working on international shipping as well because we feel that we hold on to something that's very, very good and very much should be the standard when it comes to vitamins and supplements. And so we don't ever want it to be an issue where people can't come into a clinic to get the shot. They can get it in the form of a pill or a shake. But keep in mind, like I said before, yes, there is a difference between the absorption rate, but we know even with the oral pills and the powders and the sublinguals that we offer, they still work better than the other ones that are out on the market in the pill form because we've even tested these in our laboratory testing as well. And I know that they absorb and I know they do work.
And Jonathan, could someone just go to their general GP and get a B12 shot?
They totally can. I think that's a great start. Most doctors' offices have been offering B12 for a while. They've actually offered it for anemia and they've offered it for diabetic neuropathy. But I would say talk to your doctor and ask them, could I get B12 shots here? And if they don't want to, say, can you prescribe some for me so I can start getting hit every time I come in for the doctor's office?
Mm. And what about one of the other cocktails? Do you think the doctor would agree to something like that?
Like I said, doctors were not taught nutrition. So at first, we get a lot of resistance from other physicians and medical practitioners because they're very old school. Why would you give B12 for someone who's not deficient? Why would you give vitamins all the time for someone who doesn't need it? The problem is that they need to be educated too. And when you start finding the movement that's going on amongst the crowd with paleo and keto and all that stuff too, those physicians that are coming out of med school right now, those nurse practitioners that are coming out of grad school right now, they're taking vitamins and they're learning about it and they want to implement it in practice. The problem is they just don't know how to do it. They don't know how to apply it. I was just talking to a pain doctor down the road from me last week. He's doing all of this stuff here, but he even told me too, he's like, hey, how do I apply it to the blood testing and the urinalysis testing? How do I apply it to diabetes? How do I apply it to thyroid issues? And I say, that's perfect. Those are good questions. This is how you do it. And so we've also made it a mission to start training other doctors to do this stuff on their own so they can help spread the wealth and the health and wellness that people need. But if they can't get it from their doctor because they're too resistant, first of all, you might have to find another practitioner. That's just the honest truth. Or two, they go off on their own and they scour the internet to see what's out there. And if they're looking for more information, they can always come to our website, SlenderellauSA.com and MSWLounge.com. And we're always posting evidence-based research articles, blogs, newsletters, all that stuff that people can use and say, hey, someone tested this on someone before. These are the results they're getting. I can get access to it by just making an order online. I'll get it within, 3 to 5 days.
Awesome. And Jonathan, would you recommend the listeners, if they do go to a different place, perhaps they're not in Austin and they say, for example, in New York, and we find a hangover place or or whatever, and then they do offer, say, a B12 shot or something that you feel like you need, are there any questions that you would recommend our listeners ask the clinic?
Sure. That's a great question. So the type of doctor that you would look for, first of all, to maybe give you advice on this and administer all this, they're usually referred to as a functional medicine doctor. Okay. And there's a whole certification program for physicians to become functional medicine doctors. They usually had to do some outside training, maybe a fellowship or diplomat to get it done. But you can Google functional medicine doctor and you'll find all kinds of practitioners throughout whatever state or city that you're in. And you can go with them. And usually they're the ones who also do hormone replacement and do food is your medicine and recommend nutrition as well. But if you go into another IV place, the one thing I would ask them is, do you treat anything besides hangovers? And if they say, yes, we have stuff for anti-aging, we have stuff for detoxification, we have stuff for, athletes, for recovery. You would start asking, what ingredients do you use? Can I see a list of the menu items? If they give that to you, you kind of know that they kind of know what they're doing. But if they just say, oh, all we do is hydration and hangover, everything's already pre-made beforehand, that's kind of one of those places I probably would not visit on my own, just because I'm like, hey, if I'm in New York and I need hangover IV, you can probably, find that anywhere and get a big bag of saline. But if I'm there for a presentation, I'm going to want something to help, as far as a nootropic goes, I'm going to have to go seek that out. And if they don't offer that, I'm going to say, you're the wrong place for me. I'm going to go somewhere else.
And I presume that you also recommend saying, are your supplements FDA approved?
Yes, of course. And that's the thing. What is the source of your vitamins? Do they come from an FDA pharmacy? Most of them will. But then you got to say, okay, well, are they pre-made? Do you mix them here? Can you tell me a little bit more about this ingredient, what it's good for? And you can even question the staff. And the biggest thing that I look for is if the staff knows what they're giving people, then I feel confident in knowing what I'm getting, right? Because this is a very invasive procedure, right? Like it's a service, right? I'm literally sticking a needle inside of you and you're trusting that I'm giving you what I say I'm giving you, right? And then I'm not going to cause some weird reaction. So if I go to a nurse or a paramedic or something at one of these hydration places and they're like, I don't know what arginine's for, I've never heard of glutathione, I'm probably not going to let them stick anything in me because I'm saying they don't know what they're doing. And every member that we have here on staff, we have made sure we train them to know a little bit about each of these ingredients. That way, that person, that consumer that comes in here, knowing what glutathione is or not knowing what it is, feels more confident, making sure that they feel comfortable with the service they're about to get, not only for themselves, but that way they can tell a loved one, a family member. They can say, hey, I've been getting these glutathione shots, and it's been really helping me because, now I have better sleep and I have better workouts and I have better muscle. I just feel better. Because if you tell someone, hey, go see Jonathan in Austin, he gives you these shots. I don't know what he puts in there. I don't know. He just does something. That person's not going to want to know that. They're like, I don't trust this guy. I mean, he doesn't even tell you what he's giving you. I tell everyone exactly what we give them every time, even write it down for them. That way they learn more about it. And that way they can pass that same information to a loved one.
Awesome. And Jonathan, a lot of our listeners are actually pretty fit and some even very fit professional athletes. What would you recommend they take, say, if they were wanting to improve in performance and then also when they want to recover?
Perfect. So for any professional athlete that comes in here, even an amateur athlete, we tell them everything that we offer here in a shot or an IV or even our drinks, they're all safe for professional amateur use among athletes. Now, I know that's a huge issue because the last thing I would want is to jeopardize someone's career or profession. So everything in here is safe for any athlete in any sport. That being said, for athletes, I would look favorably at the amino acids, okay? So there's arginine. L-arginine is a great one for circulation. It also gives bodybuilders those big veins, so they love that. But it's also a precursor to HGH. And you know and I know HGH is illegal. You can't give HGH to someone who doesn't actually need it. But if you wanted to do it naturally where you boost your own growth hormones, high doses of arginine could do that. L-arginine is another amino acid that I absolutely love because it literally goes in there to the muscles, regenerates and repairs torn muscles, that have tons of lactic acid in it. And then it also gives you the strength in those muscle fibers to build up a little bit more muscle mass. Taurine is another one of my favorites because taurine is actually like glutathione's little brother. because it helps not only make bile, but it helps regulate liver detoxification and it detoxes the muscles as well. So we love giving taurine for athletes for that sense. And then, one of my other favorite ones is glutathione. Now, glutathione, I keep bringing it up again. I guess I should just tell the listeners what glutathione is in case they don't know. Glutathione is an amazing antioxidant. In fact, it is the most abundant antioxidant in our entire body. Every time that we eat spinach, that we eat pineapple, you eat blueberries, you're putting antioxidants in your body in order to increase your own production of glutathione. If you get a chance to get glutathione in a shot or an IV, go get it. Just get it, because glutathione has been shown to help kill cancer cells and keep the growth of cancerous cells from spreading throughout the body. Now, when you give that to an athlete, like an endurance athlete, the research articles that I've read, it helps boost their performance to another level. Because think about that post, workout recovery phase, where you're kind of lethargic, your muscles are really sore, you don't have the energy or the drive to get back out there and do another race or do another workout, even, pumping for 2-3 months straight. You need to detox. Glutathione flushes your system of all those free radicals, lactic acid, and it basically recharges your body from a cellular level. That way, your recovery is a lot quicker. And you can actually go and perform better because you're recovering quicker than what you normally do. And I always tell everyone, you probably say this too, recovery is prevention. If you don't recover as well, you won't perform as better. That's why I think glutathione, L-arginine, carnitine, taurine. Oh, and one more, L-glutamine. L-glutamine is also another one people should do because L-glutamine helps not only build muscle mass, but it helps reduce inflammation of the gut. And one thing that athletes probably never think about is how their diet is affecting their overall health. Athletes think about, if I eat more protein, I build more muscle. That's fine. But I'm not in the line of trying to, bulk up and look like Jay Cutler. I'm just not trying to do that, right? I can't do that. But imagine if I want better absorption from all the supplements that I'm taking in my system. I want better absorption from all the avocados that I'm eating every day because I want to absorb that good fat and turn into good cholesterol and good hormones. I need my gut to be working optimal. And all these people that have digestive issues should all be taking L-glutamine because it's going to lower gut inflammation. But for athletes, it's also going to help build muscle mass.
Awesome. And for those who may be interested in a franchise, are you franchising yet?
We are franchising. So we have several people who have been talking to us, and we definitely want to get this out to the masses. So if anyone who is listening is interested in doing this, you don't necessarily have to duplicate exactly what we're doing in Austin, but you can definitely incorporate the shots and IVs. Reach out to us. My email is info@mswlounge.com or info@slenderellausa.com. Just drop us a line. Tell us, what part of the country you're in, what you do. And it's not limited just to medical providers. I am a nurse practitioner. I have a medical license in Texas. But if you don't have a medical license, we work with several people who don't have a medical license who incorporate this into their business. We help oversee a lot of the operations to make sure they're doing everything on a legal and from a liability standpoint correctly.
But presumably they'd need a nurse practitioner to actually give the injections.
No, actually they don't. They need a nurse, or they need a paramedic, or they need a medical assistant. If they have a medical assistant, most likely they're in a doctor's office already doing this. If they're a nurse or a paramedic, a lot of the state laws allow nurses and paramedics to basically operate mobily without having a medical practitioner physically alongside them the entire time. So like, for example, at the paleo event we went to, we sent a nurse out there, and they were able to give shots and IVs. I didn't necessarily have to be there to do that. I was just watching them. I drew everything up for them just to help them out because I knew we were going to be busy. But a nurse can operate on their own without the doctor or a medical practitioner having to be there on site. But they do need a supervising physician or practitioner in that state to make sure everything's going well.
Awesome. Look, Jonathan, you have really enlightened us all, and I am sure our listeners got a lot out of this. So thank you very much. And a shame we don't all live in Austin and make it so much easier for us.
I wish. The funny thing is, this is probably going to be an opportunity for me to travel more and go see more of the country. I've never been to New York, so I definitely want to come up and visit you whenever I do go up there. I feel lucky enough to be in Austin. You being at Paleo, I'm sure it wasn't your first time there. Michelle and Keith Norris told me something very interesting. I think this is true. Austin is trying to be the epicenter for all health and wellness. And you see it when you go downtown, you run Town Lake, you see all the cyclists, thanks to Lance Armstrong, it's even more popular. But people are very fit here. And it's one of the healthiest cities in America. And I think with all the people who come in here and constantly visit, I think they take away some of that health and wellness. Oh, there's a gluten-free bakery here, or there's a paleo keto friendly restaurant over here. And then they go back to their home and they try to incorporate a lot of those same things. Now, granted, they all can't take, shots and IVs home with them, but they can take a little bit of information and education to where they could pass that along to other people. And that's how the movement and the grassroots movement continues to grow. But yes, if anyone is ever in Austin, please come and visit us. But yes, we're also moving on the idea that we need to get this out to the masses. So maybe within a few years, you might see more MSW Lounge popping up throughout the country, maybe in Manhattan, and maybe you'll see more Slenderella throughout the country as well.
And what about overseas?
Overseas, we haven't forgot about y'all too. The international laws as far as regarding, medical practitioners and all that is a little bit tricky. I kind of want to nail down the US first before we go out there. But yes, anyone who's international, you can definitely buy Slenderella Boost. You can buy, some of our products online. We're thinking about y'all. We want to get this out to y'all too.
Awesome. And just before I let you go, Jonathan, I've got to ask you a question that we ask all our guests on the show. And that is, do you have a tattoo?
I do have a tattoo.
And what is it?
It is my family crest. It is on my left deltoid, and I'm very proud of it because my last name is Mendoza, and me and my two sisters both got the same tattoo. They got theirs on their upper back. I'm very proud of the family crest because my family is everything to me. With Mother's Day, yesterday, I got to spend time with my mom, and I got to spend time with my sisters and my wife, everyone's mothers. And it's this common bond that we always have, that no matter how far we go in life and what we see and what we embark on and what we conquer, we still have a very good support system that's in the form of family. And I want to be able to pass that along to my sons and let them know that that symbol on my arm represents, diligence and honesty and loyalship and basically everything that I've ever wanted a person to embody. And I'm very proud to say that I want this tattoo on their bodies as well. I will say I do want more tattoos. Every time I see more people with more tattoos, I do want more, but I'm just not sure what it will be just yet.
Awesome. Thank you so much, Jonathan.
Thank you so much, Ali. This has been an absolute pleasure.
Cheers. For all the resources and show notes from today's episode, please go to www.ali.fitness. If you liked today's episode, please show your appreciation by going to iTunes, give us a 5-star review and subscribe.